As part of my decision-making process, I spoke to everyone. My family, my husband, friends, people that I knew that had had it done, and that was the best thing, just getting lots of different points of view. I also researched a lot of doctors, internet, speaking to different medical groups, just working out what was going to suit me the best.
I first decided that I was serious about having it done when I was kind of nearing the end of breastfeeding my twins. Because as my milk ran out, my boobs just deflated. And I did actually call the doctor and say, how long after I finish breastfeeding am I allowed to have surgery done? So I was all guns blazing.
I think the most important thing is knowledge and education. The women come in and they either want to change in shape of the breast, change in size of the breast, match the size of the breast. There's a variety of different options, but they know what they want and that's their goal. But of course we have to do an operation to get there. So firstly we have to look at all the options in terms of making choices for the surgery, which incision, which plane, what type of implant, what type of surface to the implant. We need to talk about how these things lead to differences in risk and benefit from individual choices. Do we need a lift as well as an implant? Do we need fat grafting added as well as an implant? What are these things going to add? What is the result going to look like without them? What's the result going to look like with them? And if the consultation goes through this process properly, women will understand what each different element adds and what the drawbacks are, so that they can work out what combination is going to get them closest to their own personal goal.
So a surgeon that I saw said I was a borderline lift, but I would probably be more happy if I did get the lift. And then I saw my surgeon that I chose and he said, no, you're definitely a lift. Like, you won't be happy if you didn't. And he did explain to me if I was to just get straight implants, they would just still be sitting low. So I have low set breasts. I'm like, okay. They looked very sad at the time, I remember. And yeah, that's how we sort of came to the plan. And then, you know, we talked about scar treatments and all that sort of stuff as well. That's what I was a little bit concerned about, was the scarring for the bigger procedure. But it's, you know, I've done a lot of the LED heel light therapies on them and they look really good. So I'm glad I went with the lifter. Yeah, so glad.
So for a young woman with a firm breast that is wanting to boost her size, they're often got quite firm tissue and we need a firm gel to really impact that and work with that so that it feels like a single entity. Whereas another lady who may have had a couple of children, never really gained any weight and has a soft, more mobile breast, we need to put in a softer gel, something that's not going to be feeling as though it's separate from the breast. We don't want to have a rock in a sock.
I was lucky enough to have known two friends that had seen the same surgeon. So one of my friends had seen him about a year before I had my procedure done, and she had had a correction with him for a similar condition. So I had a slight tuberous breast, which just means the shape was slightly abnormal. So she had a slightly more severe form of the condition, but she had got a correction with this surgeon and hers looked amazing. And so I knew that I was going to have a great result with this surgeon as well, because I had a similar condition. And then I also had another friend that had seen him like years prior, and she was a curvy girl like me, and I had no idea that she'd had her boobs done. So when I found out, I was like, no way. So I just knew that I was going to get a really great natural result by going to this surgeon.
Ptosis, tuberous breast, all of those little asymmetries are present in almost every patient I see to some degree. Asymmetry is the rule when it comes to breast surgery. It's normal. Tuberous breast, about 80% of women actually have some sort of tuberous change in one or both breasts. They're things that we look for, they're things that we can address with certain techniques in combination with the placement of implants or sometimes even other adjuncts such as fat grafting. And then when it comes to ptosis, that's par for the course. It's a problem with gravity, of course, and breastfeeding and all those other things that just the natural aging process develops for people. And so that's something that we need to look for, and then again try to find techniques that we have to implement to achieve the result the patient's chasing.
I think I said to both my surgeons I didn't want them to look ridiculous, but I wanted them to look like they've been done, you know. And so and I think the surgeon that I went with was like, on the scale of like real to fake, what do you want? And I was like, well, somewhere in the middle. Like, everyone starts with what they've got, you know, you've always got to consider that as well. But I kind of just said I want them to sit up and just to look good with no bra on, really. And yeah.